So hello, welcome everyone to our short series about the new health equity physician fee schedule that was put out by Centers for Medicare and Medicaid, CMS. So we're happy that you've joined us and you want to learn a little bit more about this and how it can affect patient advocates, independent patient advocates, and our clients. So let's start with a little bit of background about us. In case you don't know us, we'll share a little bit about us ourselves. So I'm Jennifer Whalen. I am a physician assistant, and I used to work for Melissa practicing patient advocacy. She trained me. And now I work solely for the Bridge Health Advocates, which I own and operate with Melissa, where we train medical professionals to work as independent patient advocates and to create and enhance their own businesses. So Melissa, do you want to talk a little
Yep,
bit about yourself?
sure. I'm Melissa Cardine, and I've been a nurse for a long time, and happy to be here today to be talking about this. I have been practicing patient advocacy since 2015,
Mhm.
and then since 2019, Jennifer and I have been working at the Bridge Health Advocates. And so just really to be excited to be here today and to be talking about this topic. Jennifer and I were always just studying the world of healthcare and patient advocacy. And this came on our radar in the end of 2023 and the beginning of 2024. And so we have really been researching it, trying to learn more about it. And we just hope today that we can start some dialogue about this topic.
Yeah, and you've been talking to some people
Yep.
in some of these fields as well, so it's all good stuff. I wanted to refresh our brains about Medicare. So just remember why we're talking about this. Why is it so important? So Medicare in 2022, they provided health insurance for 65 million people. So that's a lot of people. It's 18.7% of the population at that time. So that's 54 million people who are enrolled due to their age, and the rest are enrolled due to disabilities. So that's a significant part of our population that is affected by, this new fee schedule. I wanted to share a little bit more background about CMS and health equity. So what does health equity mean? And I love definitions, so I'm just going to read this to you guys, what their definition of health equity is. So the attainment of the highest level of health for all people. That's a big goal. Where everyone has a fair and just opportunity to attain their optimal health, regardless of race, ethnicity, disability, sexual orientation, gender identity, socioeconomic status, geography, preferred language, and other factors that affect access to care and health outcomes. So that's a big deal. And we know how much these things can determine, health outcomes if you live in a rural area, or if you're female, or if you're Black, or so many different things can affect your health outcomes. And I think it's great that CMS is dedicated to, providing some changes in their fee schedule to address this. So CMS also has a framework for health equity with 5 priorities to reduce health disparities. So one is they really want to focus on the data. How do they collect it? How are they report it? How is it being reported? How are they analyzing it? So that's really important. Without the data, you're just making up stuff, right? You could say, oh, this is happening, but then you look at the numbers and it's really not. So data is important for everyone to use for their own research, to plan their programs, for a number of things. To commit, federal funding or others, I mean, that's important. So they also are, another priority is assess the causes of disparities within their programs and address inequities in policies and operations to close the gap. So they're really looking inward too about, what their programs are doing and how they are supporting their health equity goals. They want to build capacity of healthcare organizations and the workforce to reduce health and healthcare disparities. So that's great. It's like branching out what can we do in this hospital system to help these, healthcare workers address health equity. Then advanced language access, health literacy, and the provision of culturally tailored services. And I think that's something that advocates always, I know you do this, Melissa,
Yep.
that's in the back of our minds. We absolutely are hopefully providing culturally competent services to our clients, addressing their health literacy, and for sure they're getting the assistance with language if they need that at any point that they are within the healthcare system. And then the last one is increase all forms of accessibility to healthcare services and coverage. So that's really important. Um,
So these are all really, really great things that we're seeing by CMS.
for
So
sure.
what other things are we seeing that CMS offers to help providers or healthcare organizations that address health equity?
They actually do a lot through the Office of Minority Health. So I'll highlight a couple of them that they put out there. One is the Health Equity Technical Assistance Program. So it offers health equity technical assistance resources. They're trying to help healthcare organizations take action against these health disparities. And then again, they focus on that data. So they have this stratified data and reporting. So they're taking in information. They have a lot of information. I mean, if they're covering 65 million people, they've got all their
Yes.
health data, you know,
Mhm.
stored somewhere. And you want people to use it for their research to, help change these health disparities. And so that's another important thing that they have. Researchers can get access to that data to help improve the health of their population. So those are some neat things, and I know that there's more. And what
Yeah.
we will have a list of resources through CMS that we can get to you guys if you want that information. But that can help you learn a little bit more about a couple of these organizations. Um, so Melissa, do you want to give us, let's start digging into the
Okay,
actual,
sure, sure.
fee schedule. So if
Yeah,
you can give
yeah.
us like a little brief overview of what they put out, CMS put out for us, and what we're going to dig into over the next sessions that we're going to do.
Sure. So in January of this year, 2024, we actually saw a new fee schedule
Yeah.
that came into effect, and it's really in an effort to support the services that we were just talking about, health equity. So they're actually categorized several ways, and one is caregiver training, which we're
Mhm.
not going to dive into at this time, but it is something that we need to be aware of as patient advocates. The other thing is community integration, and we are going to dive deeper into this into another series. And the other one is principal illness navigation. And we sort of call it PIN services. And that too is divided up into PINs and then also principal illness navigation peer support, which is more specific to those with mental and behavioral health
Okay.
issues.
Oh, perfect.
Yeah. And so, yeah, it's exciting that we have this new fee schedule, but with any fee schedule, we're also trying to actually understand it and
Yeah.
what it means for providers. And, Jennifer, you've been a provider as a physician assistant.
Yeah.
I myself worked in the hospital system running a clinic. So when we get these new fee schedules, we're really trying to understand it from the provider standpoint. And then also as patient advocates, we're trying to understand, well, what does this really mean for patients and the clients that we serve?
Mhm. So what kind of guidance do we get from CMS? What did they give us? Just give us a little bit of a taste of it in the fee
Sure.
schedule. And again, I
Yeah.
know we'll dive deeper later on, but
And yeah, and the fee schedule is available for you to review. Some of them can be extensive. There's some summaries of the fee schedules that you can review. But there's always, we're just trying to really understand, and there's a little bit room of interpretation, like, well, how do we interpret that? But they talk about who can provide these services
Okay.
under the fee schedule,
Yep.
how you need to be trained,
Mm.
um, how you initiate the services through an assessment, and then how you bill the services that you provide. So we see the CPT codes,
Mhm.
we see who qualifies for these services, and how they are similar and different amongst the other services that CMS reimbursed for, some care management services. So we do see that with this new principal illness navigation, that in order to understand that, you also need to understand the previous care navigation services and how those are built.
So some of those other ones, and I know you've looked into this, and tell me if I'm missing any. So there's chronic care management. Well, there are a lot, to be honest.
There's
Chronic
yeah,
care management, there's transitional care
additional care
that can
management.
also help.
Yep.
I know that there are others, and I'm trying to think of them. We can talk about them when we
Yes.
hints
Yep.
too. I started to see some in telehealth, like their telehealth,
Yep.
they're adding to telehealth all the time. And one of the new ones that they're covering there is health coaching. So
Yep.
that's it's a lot. And it's just interesting how practitioners are going to put this into practice.
Right.
And I know sometimes it's trial and error, they're going to do
Yep.
something and document and bill for it. And then, are they going to be, reimbursed for it? So it would be interesting to hear, what's going on in, on the ground.
In the provider world,
The provider,
how now
yeah.
with this new fee schedule, how are they actually going to integrate it in their practice? So
Mhm.
if you're a primary care physician and you're already doing chronic care management in your office, how are you now going to integrate this? Or if you're a specialist, how you're an oncologist, you're a cardiologist, how are you going to integrate this into your practice? And again, so what does it mean for the consumers?
Yeah,
What does it look like?
yeah,
And understanding the billing portion, because, when we are billing for these services, okay, did this fall under chronic care management for me? Did it fall under principal illness navigation? And why am I getting two bills? Oh, well, this provider's providing this service, another provider's doing this service.
yeah.
Um,
How do you integrate that, right? How do you
right.
know one person is billing, PIN navigation services for this illness, and then another specialist is doing that, and then, oh, this person isn't going to get reimbursed because, they billed second. I don't know. I mean, I think that's interesting. There's so much to it. And I'm really also interested in the um, training, like who can provide these services. And
Yep.
I we'll talk more about this, but
We
I know
will.
that
Yep.
the practitioners can order it, the doctors can order it, PAs, NPs, but then it also, like, the provision of services it can go through other parties. So who
Right.
are those
Who
parties?
actually is going to be providing these types of services? It may be
Mhm.
ordered by your primary care physician, but it might not be somebody in your primary care physician office providing these navigation services.
Yeah,
And
that's
so that's why it's an exciting time to sort of, we have been reaching out to those in the community who offer these type of services, really just to learn more from them. So
yeah,
what does this mean to you and your practice? How are you incorporating it? When will you be incorporating it? Will you be incorporating it?
yeah. Have they already done it?
Have you already done it? Have you already been doing this type of service, but not really capturing that billing for it?
Right,
We all know that these type of services need to be offered.
right.
And at times they are done, they are offered,
Mhm.
but there wasn't any way to capture that in a billing way. And like you said, before, collecting data. And that's what a lot of these came out of data that has been collected over time.
Mhm.
And now we'll see more of concrete, so to say. We hope, right, that Okay, now we know that people who had principal illness navigation for, let's just say, oncology, for somebody who has cancer, that we
Mhm.
know that those who had this type of services benefited this way, right? They had increased access to care. They didn't have to go to the emergency room when there was an exacerbation, that they were able to see their provider or get in for a procedure. So it does come back to data. And
Mhm.
some people are data junkies. So if you
Yep.
are, we would love to talk with you and learn more about, the data that has been collected and what plans for data and what should we be looking for
Yeah.
as professionals in the industry.
Yeah, absolutely. All good points, all good things to, discuss and talk about. It sounds like a lot of information,
It
Melissa.
is, it is.
So tell us what's up for us next with.
So yeah, we really just wanted to come on here today just to provide a very brief overview of the new physician fee schedule. Again, that came out in January of 2024. And so our next session, we're going to take a deeper dive into principal illness navigation. So we
Okay.
are going to talk more about what that is, how it's provided. And again, we're open to people reaching out to us to glean more information. Then the next one we'll talk about is community health integration.
Okay.
We have seen that in Arizona for some time now, so I'm actually looking forward to talking about that. And personally in Arizona, what I've seen. And then we're going to do a wrap up. Our final session will be really on, so what does this truly mean for us as patient advocates and for patients and the clients that we serve?
Yeah.
And that's really, in order to have that conversation, we truly need to try to understand as best as we can these other entities, these other services that are offered by CMS and our providers.
Yeah, absolutely. So what are some of our, like, why are we talking about this? What are what are our goals? And some of them, I know our goals are a little more vague. Like, we're just trying to start this conversation about,
Absolutely.
we live in this healthcare world, this advocacy world, and just, starting a conversation and seeing where people are at with that. That's, I know, just one of our
Yeah.
big
Yeah.
reasons. Yeah.
And when I sort of, took the leap, right, and started patient advocacy in 2015, the one mentality I went in with it was just being open,
Yeah.
right? And we always might not know, right, what the next year, 2 years looks like. And so, but what we do know is these type of services are needed, by our community. And so that's why this is all very exciting, that
Yeah.
we're actually just saying like, wow, like they're actually know that the type of services we provide with, transitions of care and communication and education are necessary.
Yeah.
And so when Jennifer and I even started working together and we started working on developing, what is really advocacy and how do you practice advocacy, the one thing we said is we are always going to be open and receptive, right? And we truly don't know what is going to happen in our healthcare system, over the next year, right? This is something new that we need to be aware of, and we don't know what the next 3, 5 years is going to look like. So
Yeah.
that's why we're starting these conversations. And we hope to bring other people to the table,
Yeah.
um, that we
Absolutely.
can have these discussions with, always keeping in mind that it's really about the consumer, even us, right?
Mhm.
And the type of care that we want and we desire.
Yeah. I mean, that's the one thing that you can count on is change in the healthcare system. That's a good thing because
Yeah,
this healthcare system is so difficult as it is. And, if you're really being consumer minded and trying to help them and do the things that are actually going to improve their healthcare, maybe streamline things for them, maybe make it a little more cost effective, then I'm all for it. And that's great. And I think CMS, I know this sounds crazy, but they've always been a leader in this. I mean, they're the ones that are,
Yeah.
you know, if you accept Medicare patients, then your services have to align with all of their, mandates, regulations. And so that actually improves and helps out people who are on private insurance and,
Mhm.
have no insurance and everyone. So I think it's a good thing. It's always, important to keep it under scrutiny, but I'm here for it.
Yeah.
So
Yeah.
and so tell me, I mean, these are great services. These are a lot of services that advocates provide for their clients in a very
Yes.
holistic sense.
Yeah.
Advocates, independent patient advocates, they really know their clients, their situation,
Mhm.
everything from their health to financial to socially to their living situation. Do you think these services would ever kind of replace what an independent patient advocate does?
No,
Yeah.
they won't replace, but it will enhance.
Okay. Say,
So it
yeah.
will enhance the services we provide, and that's why we need to be aware of them.
Yeah.
So if we have somebody who, needs assistance, say by a community health worker that's being offered in our community, it's just making sure that our client, their family members, have those services provided,
Hmm.
right?
Yeah.
And the same with chronic care management and principal illness navigation. If we have a client who falls under those guidelines to receive those services, that they have the option to receive those services, which
Hmm.
can benefit our clients, and also help us with the job that we're trying to help them with. But we're still always going to see those gaps.
Yeah.
And we still haven't seen that there's really one person really knowing that person's true story, their wants, their needs, their desires. Um, maybe down the road we'll see that, but that's really patient advocacy is a unique field. So we're not going to see it replace patient advocates. We're just going to really see it benefit those that we serve.
Yeah, I agree. I can't see it coming from within the healthcare system of someone who does bridge the gap between the healthcare
Right,
system and what's going on, at home in the lives of
right.
consumers,
And
patients.
as we know, as patient advocates, we can't help and serve everybody, right? So these type of services will help with those who one may not be aware that they have the option to have a private advocate. It introduces them to, wow, there's actually somebody, in the community that reached out to me that realizes, I have an issue in getting to my appointments, my dialysis, and they're taking the initiative to help me, and be my advocate so I can get to my appointments.
Yeah.
So we're seeing that people who are struggling with a chronic illness, right, and are overwhelmed with decisions and maybe not getting the medication they need, and it being delayed, that now somebody reaches out to them and say, you know what, we were notified that, you would benefit from us assisting you on, say, getting on a clinical trial for a medication, or, that you're having issues with this medication and affording the medication.
Yeah.
So, as we know, as independent advocates, we're not able to always help and serve everybody. And sometimes that's what I hear from people like, well, I want to help people that, maybe can't afford these type of services. And so that's why this is good, because we're seeing that you can always, direct them and say, have you discussed with your primary care provider?
Yes.
Have you reached out? What we'll talk about when we dive into community healthcare workers is really state by state. And
Hmm.
so you will need to know like more, where do you live and how are these services being provided? But they're
Hmm.
great resources, even if you're just in a conversation with somebody, or if somebody does reach out to you and maybe aren't appropriate for your type of services, that you have resources to offer them to say,
Mhm.
you know what, I know this organization, they can help you with these transportation issues that you're concerned about. So it's really just exciting
It is.
time.
And you,
Yeah,
and what makes me think is you can really, I mean, there might be providers who don't know that they can get reimbursed for these services, and
absolutely.
just bringing it to their attention, you
You're
know,
right.
you can bill
Yeah.
for this and you're going to get reimbursed a decent amount for
Yes.
talking about
Right.
addressing the social determinants of health. And it's not a super hard thing to do. There's already like the assessments out there. You just
Yeah.
document that and then spend some time on
Yeah.
those issues. So I did want to get into this little quick session, the overview of just what social determinants of health are. And I am
Okay.
hoping everybody by now knows what social determinants of health are. They've been talking about them since and researching them
Right.
since the 70s and earlier,
Yes.
probably. Um, but I just wanted to put that out there, and we can get into them more with community health integration too, because that's what they do.
Yes.
They're
Yep.
addressing those, and that's what they're getting reimbursed for. Um, so they are, and I think this is a definition that I got from Healthy People 2030. So
Okay.
in case you guys are looking for it, they are the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So that's pretty important. So they break down the social determinants of health into 5 categories. So economic stability, yeah, so important. Education access and quality, healthcare access and quality, neighborhood and built environment, healthcare, oops, I said that one, and social and community health. And again, those are from Healthy People 2030. So we'll get more into that, but when we say social determinants of health, those are the
Right.
types of things that we're talking about. Is where you live, is it safe? Do you have access to reliable transportation, whether that's public transportation or private? Can you get fresh fruits at the grocery store? Can you get your medicine? Do you have, are kids staying in school? Like so much that affects our health, in America and in our lives. Um, so we've talked about a lot. Is there anything that you can think of that we haven't addressed or that we wanted to talk about a little bit more? I know our
I
next
think
session is the PIN session, is the
yes.
principal illness navigation session.
Yeah, and I think the next time we'll, go more over that and provide the overview
Mhm.
of that. There is a lot of information out
Yeah.
there on that. And it definitely requires some time to
Mhm.
truly go over um, the fee schedule, how we're going to see it maybe implemented, maybe some examples of how we might see it implemented. So I think at this time, this sort of just provides that overview that this is why we wanted to start this conversation and give you a little bit of background on these things that we have been reading about, studying about,
Yeah.
having conversations with people about. Yeah.
Yeah, perfect. And just a reminder, we have a list of resources
Yep.
for all of this. So we'll let you know how you can access that list, how we can get that to you. And we just want to thank you for
Yep.
joining us today.
Yeah.
You've been good to kind of start getting this out there. We really hope you're going to watch the next sessions and how we talk about, what that means for independent patient advocates, our clients, and all healthcare consumers. So thank you so much. Take care,
Yeah.
everyone.
Thank you.